So this is the latest update on MAID, which is the medical aid in dying. Okay. So there are now 12 different states or vicinities or jurisdictions in the United States that now have MAID. And the latest one is Delaware. So these are the 12. So Delaware, California, Colorado, Hawaii, Maine, Montana, New Jersey, New Mexico, Oregon, Vermont, Washington, and Washington, D.C. So majority of the country still doesn't have that legislation, but we have now 11 states and Washington, D.C. And since 1998, when this all started, they estimate about 15,000 people have actually utilized the medical aid in dying. So the people who usually take advantage of this fall under, they're usually well educated, they're usually affluent, they're usually greater than 65 years old, and usually most of them are white or Caucasian. So the ethnic backgrounds, usually people aren't taking advantage of it. So again, usually it's well educated, affluent, greater than 65, and white or Caucasian. Those are the common person who uses MAID. And they're usually on hospice or palliative care, and majority of the people are either dying from cancer or Lou Gehrig's disease or ALS. Okay, so those are the usually. So the Alzheimer's, dementia, people with COPD usually don't utilize it. Usually ALS or some kind of cancer, and they're usually on hospice or palliative care. Okay? And of all the people who are dying, about 1% will actually utilize the MAID. So these are the criteria that are usually in place. It was modified again in the last 5 years, but the latest is that you have to be terminally ill. You have to have some kind of decision-making capacity, so you can't be impaired. You have to have some kind of incurable or irreversible illness and a prognosis of less than 6 months. So that's been pretty standard since the beginning. Okay. 1/3 of the people who fill the prescription never go through with it. Or I take that back. Yeah, 1/3. So a lot of people do use it, but 1/3 will actually fill the prescription or never get the prescription filled, okay, even though they have the ability to do so. Okay. The most common ways that are being done is that it's a powder. So the common way is they put it in 2 or 3 ounces of applesauce and take it orally. People who have G-tubes or rectal tubes, they actually have a plunger that they can self-administer through the G-tube or the rectal tube. But California just passed a legislation that they can actually use it IV. So that's the only state in the whole country that is allowed to do that. So most either have to ingest it orally through the G-tube or through the rectal tube, but California just passed legislation that they can actually do it through IV. Now the problem with that is that they may not have access or they may not have the drugs to do it IV, but at least legally people in California can give it to themselves IV. Okay, so the doctor still can't do it, the nurse can't do it, family members can't do it, but if it's set up, people in California can give it to themselves IV. But again, there's the logistical problem of having IV. Okay. So what usually happens is that most people will fall asleep in a few minutes and usually die within an hour. So it's not, if it's done correctly, it's not something that's prolonged. It usually happens pretty quick. They'll start becoming sedated in about a few minutes and then usually will die within an hour. So it's fairly quick. Okay. Now, each state has different criteria, different rules of the game, and usually the, the main differences across the states is who can prescribe this and how long you have to wait before you can get it. Okay? So usually you need two clinicians to kind of say it's okay or it's appropriate to apply MAID. Now, not all of them have to be doctors. So in the state of Colorado, Hawaii, New Mexico, and Washington, it could be done by a trained nurse. So instead of a doctor making that decision, advanced practice nurse can actually replace the doctor in those 4 states. Okay? Now in the state of New Mexico and Washington, a physician assistant could do the same thing. So that's not in all the 12 jurisdictions, but in 4, nurses can do the job of a doctor, and in 2, physician assistants who are trained can actually make the decision or prescribe it. Okay? Now, if there's any kind of doubt whether the person is competent, then they can call in a mental health provider. And in some states, the nurse actually is trained to do that, to decide if they're competent or not. So now they're spreading the power to other people, other medical providers, okay, to make it more accessible. Okay. Now, typically what is required is that the patient has to be able to ask 3 different times just to make sure that it wasn't a bad day and that they really want to do that. So they have to ask 3 different times, and on 2 of those time periods they have to be able to, it has to be 15 days apart. So again, if there was a bad day where they had extra pain or they were depressed that day or something happened, they want to make sure that they really want to do this. So they have to ask 3 different occasions, and on 2 of those occasions it has to be 15 days apart. So it's not just a bad day, but this is something they really want. Okay. The exception is California. California, the caregiver or the doctor can actually waive that criteria. So in California now, if for some reason the person's going to die quickly and they don't have time to go through all these different waiting periods, the doctor can waive the time period. Or if they're declining enough that we think that they're competent now, but in 2 weeks or 3 weeks they're not going to be competent, the doctor can waive the waiting period and do it now. So that's different than the other 11 states. So California is one where we don't have to wait that time period. So if they think it's important to do it now, they can do it now. Okay. Now in two states, you don't have to be a resident of that state. So in California, a person can't come from another state and obtain the MAID in California. They have to be a resident, whatever that qualification is. They have to be a resident. But in 2 states, Vermont and Oregon, you don't have to be a resident. So if somebody from another state wanted this right away, they can go to Oregon and Vermont and get it right away. But in most states, you have to be a resident of that state for them to have MAID in that state. Okay. There's something called institutional transparency. So by law, a doctor doesn't have to be made to perform or provide MAID, and an organization doesn't need to have to do this. So legally, they have an out. But if they are not willing to do MAID, then they have to be transparent. And so from the get-go, they have to let them know that I'm a doctor or we're an organization that doesn't provide MAID. And in California, that is one of the requirements. We have to have institutional transparency. So in California, if we don't provide MAID, then patients who are coming on board, they need to know that from the get-go. And that's not true for all states, but California is one where we have to be transparent from the start. So that's the latest update on MAID as of October 2024.